What made you realize you were medically not okay? I was getting quickly exhausted compared to other people, especially during physical education. That until my doctor told me I had a heart condition. Also hugely important in having a good doctor. At one point we had to switch to a different less good insurance plan for a month for logistics reasons, but happened to be when I had an issue, which meant I had to see a different doctor than usual. This doctor barely looked me in the eye. And when I said I was feeling tired all the time, and despite running a marathon 2 months prior, was having trouble catching my breath after a mile or two now, she told me she wouldn't write me a prescription for painkillers, if that's what I was getting at, and that I was just out of shape, and left the room. I had pneumonia, which we only found out because my parents paid out of pocket for me to consult with another doctor. That's the ignorant crap my family told me when I had pneumonia. I insisted they take me to the doctor, that I was really sick and in pain and having trouble breathing and thought I had some sort of respiratory infection. And they tried to tell me I could take myself, that I was just fat and out of shape, but my whole arm was in agony along with my back. And I knew I couldn't safely drive. With enough pushing, I got them to take me, and they were pissy for the hours they had to wait for what was surely nothing. Guess who was right? Me. I've never been more upset with them. This is what I do not get. Unless you gained the weight recently rapidly, you know what is normally attributed to being fat out of shape, and what is probably a legitimate problem. So many people take one look at an overweight person and suddenly that person is a superhuman, immune to every ailment and injury in the world, and would lead an amazing life as a specimen for study if they just lost some weight, so we could see the true extent of their insane powers. Multiply 200b. Losing my hearing in one ear. This will be a long one. I had been suffering from muffled hearing in one ear for a while, and then started to get head pain. The doctor said it could be an infection, and gave me antibiotic drops and then tablets. It did not clear, so was referred as a non-urgent end. I then woke up one morning with no hearing in that ear at all. I went back to the doctors and was told, well, you have been referred to ENT. And that was that. 2 months later I attended an ENT appointment where I saw a registrar. He said the ear canal was clear, but there was a black dot on the eardrum. He then tried to suction it off, which hurt as he kept suctioning the eardrum onto the little vacuum. He carried out a hearing test and sure enough I had a severe loss of hearing in that ear. He then referred me to his boss, the head end consultant. So I was sent away to await a further appointment. That afternoon I went back into work. I work in a doctor's surgery and got into a conversation with a trainee GP that had worked in both neurology and ENT prior to retraining. She said she had not seen me that morning, so I explained where I had been. And she stopped me mid-sentence and made me go over the whole symptoms. She then took me to her examining room and did a few tests before asking me who I had seen and could she have my permission to call them. I said yes, and she said she would come and see me in my office shortly. Half an hour later she came into my office and told me that I had a CT scan arranged for the following day. She would not say exactly what she thought it was, but she did say it was not something imminently serious, but if she was right it did need sorting as soon as possible. So off I went and had my CT on a Saturday morning, which kind of indicated that it may not be as non-serious as she was letting on. Then went home. Monday morning I received a phone call to attend the hospital again on Tuesday. I went to the appointment and was seen by the consultant with my CT scan already on his screen. He said this was a good catch by trainee GP I worked with Maine. He then went on to explain that I had a type of corrosive tumor growing behind the eardrum that had eaten away all of my hearing bones and was now eating its way upwards into my skull, towards my brain. The good news was that it had been caught early enough and that it had been gracious enough to eat my hearing bones, thereby letting me know that it was there. If it had not done that and had bypassed them and gone straight to the skull, I may not be finding out about it until I was having seizures or worse. He asked if he could bring in some students to look at my scans and examine me as it was rare, hence why my GP and the registrar had not picked up on it. Apparently a GP might only ever see one of these in their career. Obviously I agreed, so that these students would not miss it next time they saw it. A few weeks later I underwent a 7-hour surgery to clear out the tumor and repair the damage. During the surgery they had to cut my nerve that controls taste, so I can no longer taste anything on that side of my mouth. Luckily the tumor had wrapped around the nerve affecting facial movement, but they did not need to cut it. That would have caused a permanent facial droop. So I got away a numb face, where they stretched the nerve for a few weeks but nothing permanent. While they were in, the surgeon replaced the hearing bones with a titanium disc on a stick that is cemented to what remains of the bones. The disc rests against the eardrum, so I now have some hearing back in that ear. I'm fine now, and apparently there are photos of the inside of my head in a textbook that the consultant wrote. TLDR, lost my hearing in one ear. I had a bone-eating tumor. 2 doctors missed the symptoms, but a trainee GP recognized them and arranged a CT scan. I had surgery and now all is well. Surprisingly, trainees can be your best bet to catch something really rare and bizarre. Working doctors start with the premise of when you hear hoofbeats, assume horses, not zebras, and have a very good idea of just how unlikely your disease is. Based on seeing thousands of patients, they are primed not to look further than an obvious handful of diagnoses. Trainees, on the other hand, are fresh out of school, where they have learned about all the edge case weird shit that can go wrong with you. They are more primed to see rare diseases. So basically, seasoned docs are more hoofbeats horses, not zebras, while trainee is more hoofbeats means hoofed animals. Which includes zebra, right? Yeah, pretty much. I really like the way you worded that, dude. The inability to breathe was a big clue. Same here. Turns out I have asthma. I have always had it. It is the reason why I cannot run without struggling. Even at my fittest, when I could outrun my classmates, if I pushed myself just that little bit too hard, I would end up crashing hard. As I got older, it got worse to the point where even exercising became a huge struggle. I was training multiple times a week, cycling a good few miles, and it just felt like I could not keep up. No matter how hard I tried, I would just get so out of breath that I was wheezing and my body would just stop moving. So off to the doctor I went. Wheezing when exercising is not normal. Coughing up crazy amount of mucus is not normal. Having attacks at random times in the day is not normal. Coughing going out into the cold is not normal. My doctor looked at my records, told me it was just anxiety, and tried to kick me out without listening to me. I was having an anxiety attack every single time, and he was not listening to me. I ended up yelling at him, and he sent me to the asthma nurse, who diagnosed me with asthma. Holy crap. I got my first brown inhaler and suddenly I went from the slowest and most unfit person in my martial art classes to kicking butt at all the warm-ups. I went from being unable to run to running around like an idiot. It has become hard to run again, so I need to switch my inhalers up. But knowing that my breathing problems are not in my head was amazing. Also, getting my breathing fixed got rid of that low-level anxiety I was having constantly. Turns out not being able to breathe properly can make you anxious all the time. Who knew? I was diagnosed with asthma almost a year ago. I am noticing it's getting worse. I got an asthma attack from playing ping pong last week. I have had asthma and an inhaler for over 20 years. There is a few things you can do to help. Get a good air purifier, not the 30 ones you can get at the drugstore. A good true HEPA or better that is size rated for your living space. It is hard enough to breathe with asthma. Do not intake extra junk into your lungs and make it worse. Additionally, know your triggers and how to avoid them as best you can. Food, exercise, allergies, environmental, anxiety. From there it is just working with your doctor to find what works best for you. Some people are okay with just a rescue inhaler, others need daily inhaled steroids as well. Once you find a treatment plan that works, you will feel great again. Sex started to hurt with my partner. Thought it happens. Nope. Not supposed to happen. Had cervical cancer. Oh duck. I need to go get a smear. I'm overdue by a year. Calling tomorrow. Thank you. At a girl. Broke the cartilage in my ribs coughing. All through elementary, middle, and high school. I was incredibly bad at any physical activity. I would be super slow, and would start coughing uncontrollably. And every gym teacher I had always told me to stop being dramatic and that I was just fat and lazy. Senior year of high school, I had a coughing fit that lasted about 3 months. Could not sleep very well, and mom was angry at me and told me I was just making myself cough, and if I just ignored it, it would go away. Eventually, it did. Age 26, I get another coughing attack, and this one lasts about 4 months. One day, in month 4, I cough and something in my ribs goes pop, and I'm suddenly in horrible pain. My friends drive me to urgent care. The doctor comes in and asks me when I last used my rescue inhaler. My what? Yeah. It turns out I have got super bad cough variant asthma, and I'm not lazy. I just have not been getting enough air to do physical activities for the first few decades of my life. I now have a personal vendetta against every gym teacher on earth. Also thought getting migraines every single day was something normal until I signed up for a headache study at a university and they informed me that it was, in fact, both serious and pretty rare. A lifetime of getting told to suck it up and never going to doctors except in extreme medical emergencies can really mess up how you take care of your body. God, that sounds awful. I'm so sorry. I'm a migraine sufferer and started having headaches when I was young, progressing to migraine with aura and temp blindness in my teens. Cannot imagine having them every day and not being at least given some sympathy and a headache tablet. I do have experience with suppressing medical needs, have lots of health problems no one takes seriously. You learn to cope by literally disconnecting and disassociating from your body's pain, deep suppressing your needs and feelings to make it through a day. Then, later, you realize that being connected to what your body needs through how you feel is fundamental to good health. Well, shit, yeah, exactly. The message I got over and over again growing up was push through the pain, no matter what. Turns out that's a super good way to teach kids to ignore very serious body issues. Adults really do not take the pain of kids' genes seriously, especially if they are seen as winny. I have got a pretty good treatment plan for my migraines now. At least, I have only had the aura blindness thing happen to me twice, and both times as an adult who knew what was happening and how to treat it. It had to have been terrifying experiencing that as a teen. Being in a doctor's office and not knowing how I got there, then realizing I did not know what season it was, nor month or even what year, not knowing who the crying people in the room were gave me a sense that something was wrong with me. Being unable to form intelligible words sealed the deal that I had something medically wrong with me. This was 5 months post B. How are you doing these days? Thank you for asking. Somewhat better. I'm somewhat functional. Drugs allow me to talk. I have plenty of seizures, but they are not unpleasant thanks to a dopamine promoting therapy. A few years into rehab I happened to ask a neurologist who treats celebs politicians if there was any advanced techniques the pause like me do not get, and he hooked me up. I have done the transcranial light therapy, where they zap light through your skull. That was cool. Neurogenic peptides are absolute miracle drugs. Quite safe and insanely effective. I got more recovery from 60 and neurogenic peptides than 4 years of intensive rehab. It is infuriating that these are not ubiquitous. 5 in drops in your nose during an ambulance ride after a B could resolve perhaps 40% of injuries that end up being crippling. We were just gathering a buying group to get the 220,000 per dose neurogenic growth factor thing for 2,000 each. By having the drug custom made, then a stupid pandemic happened. I'm happy to hear you are better. Could you name these neurogenic peptides? Reading about them seems to be a bit hard to find. I'm very genuinely interested. On Sunday of that week, I started noticing a little shortness of breath with mild activity like walking up a single flight of stairs at home. Then Monday realized that it was getting worse when I got short of breath walking down a flight of stairs. Decided that I would go to an urgent care center that Tuesday if sleeping with my humidifier blasting overnight did not help anything. Then Tuesday morning, I started wheezing and getting dizzy just taking the trash to the curb and decided to go to the ER. I was pretty convinced that I had COVID, as were the doctors, but it turned out to be a bad pulmonary embolism. Spent a week in the ICU and I'm still on medication for it now. 3 months later. In all fairness, it could have been caused by a covered infection. Early in the pandemic, we didn't know about all the weird vascular stuff. If you're otherwise healthy and don't have any medical reason that makes you susceptible to a pulmonary embolism, I would strongly suspect some wonky covered bullshit. I tested negative in the air and again when I got tested after being released. But yeah, I have honestly wondered if maybe I did not have an asymptomatic infection weeks or months earlier and maybe the after effects triggered the blood clot, because even the doctors were a bit stumped. I do not have any risk factors for developing a pulmonary embolism. Have absolutely no recollection of having a blood clot in my legs prior to having lung issues, and tested negative for all of the genetic disorders they screened for. For years I thought it was normal to get severe stomach cramps and headaches after chewing gum. I thought we were all just willing to suffer for our pleasures. Turns out I am quite allergic to sucralose. For years I thought it was normal for the roof of my mouth to get raw after eating Skittles for a few minutes. It feels like I am getting cut by the shell somehow. Alas, I am probably allergic to something in them, and my wife doesn't get why I continue to eat them on occasion. They still tasty though. Wait, that's not supposed to happen. My mouth is peeling right now from the Skittles I ate last night. I wonder what's in them that does that. Thank you for watching. We hope you enjoyed this video. Please subscribe for more videos.